So my name is Dr. Julian Lange, and I'm a doctor of Oriental Medicine, a licensed acupuncturist. I've been in practice here in California for about 30 years, so I am a bit of a pioneer in the field. I practice in Santa Monica, California, and my website is www.meridianholistic.com. So you're interested in knowing what a full body cleanse is. I don't know that I know what a full body cleanse is, but I'll tell you this, that a cleanse basically wants to cleanse the liver, the intestinal tract, the kidneys, and the lymphatic system. And the benefits of it is that it's kind of like rebooting your system so that you, in the cleansing process, you release all of the impurities that have accumulated in the system. And then in the process of the cleanse, you release impurities, then you bring in really clean food and nourishment that's easy to digest and very high value. So your body is given an opportunity to recharge itself, and then gradually, to whatever extent you want, you reintroduce the foods that you would normally eat in your non-cleansing life. So when you ask if there's a right age to start cleanses, I would say that young adulthood would be an appropriate age to begin, but most young people are in good health. They don't have complaints. And if that's the case, a cleanse isn't necessary. And the time one wants to cleanse is that if one is going through a disease process that is lingering, not your, a flu. That wouldn't be a reason to do it. But if you found that you were always getting reinfected, like one year you went through 4 flus, that'd be a time to start thinking about doing a cleanse. A cleanse can be beneficial. And like I said, if there was acne, that would be a good time to do a cleanse. And if you were diagnosed with any sort of more serious illness, that would be a time to really start looking at your health, maintaining your health, doing everything to optimize your health, and cleanses optimize it. So when you ask about how a cleanse can be abused, now some people might sort of be enabling a eating disorder by saying they're doing a cleanse instead of the fact that they're really doing some kind of purging. Otherwise, people that are obsessive with weight loss could abuse cleansing to, get rid of calories after having eaten them. I suppose that's the same thing as binging and purging. Then the other thing is people that are kind of obsessive about health, and they go overboard with cleansing, and they do it too often or for too long, and they end up depleting their system as opposed to restoring it. And I have had a case where a person, after a 21-day fast as a cleanse, actually ended up with chronic fatigue. So you can do too much cleansing. So about educating yourself as to how to go about doing a cleanse and the best way to do a cleanse, I think the best way to do it would be to start out with a naturopathic doctor. Some MDs, medical doctors, conventional doctors know a lot about it, but they tend to be the exception rather than the norm. Most typical family practice docs aren't going to know too much about this. So if you have access to that resource, that would be the best way to do it. If you don't have access to that resource, then read some books. You don't want to go overboard. You don't want to be over-ambitious. You don't want to try to lose like 40 pounds in 2 weeks. You don't want to try to restore your health to an optimal level the first time around. Just start slow, do a 3-day, 5-day kind of thing, and that'll be okay. How does the media portray cleansing? There are celebrities that get into it, and because a celebrity is news and anything they do is news, then any cleanse they do will become news. And yeah, it may be sort of a fad. There's nothing wrong with a fad with the cleansing. Once again, you can go ahead and do something that one of the celebrities are doing, but read about it, familiarize yourself about it, and don't be over-ambitious, especially if you're new to cleansing. And just use your common sense and get some advice. Get professional advice from a naturopath or someone who specializes in alternative medicine.